I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com.
Have you ever been bitten by a mosquito? Who hasn't? What would you do if the itching and swelling lasted for weeks? This is the People's Pharmacy with Joe and Terry Graydon.
Skeeter syndrome is a real medical condition. Some people are super sensitive to mosquito bites. What do you do for your mosquito bites? Is there a simple trick to stop the itching for hours?
Some medicines can increase the risk for dementia. Which ones are they? And how concerned should you be about anticholinergic drugs?
Do cholesterol-lowering medicines affect nerves? Research shows that lowering cholesterol levels in patients with type 2 diabetes increases their chance of developing diabetic polyneuropathy.
In the People's Pharmacy Health Headlines, could blueberries improve blood pressure and cognitive function in older people? Several different studies published in the Journal of Gerontology offer promising results. When it comes to cognitive performance, it seems that those who already notice some impairment might benefit the most from consuming a daily cup of wild blueberries. In one study in rats, the animals that performed poorly on a water maze test significantly improved their performance after 6 months of blueberry supplementation in their chow. Those who performed well initially did not improve with blueberry supplementation, but they also did not make more mistakes as animals in the control group did. Blueberry supplements reduced inflammation in the brain. Older people also benefit from blueberry supplementation. Here, too, those with cognitive impairment at the outset benefited from a supplement containing polyphenols from blueberries and grapes. Seniors who started the study with good cognitive function did not experience noticeable improvement. Another study in humans demonstrated that volunteers drinking blueberry beverages for a month lowered their systolic blood pressure. Those consuming placebo beverages did not. The researchers identified the colorful compounds called anthocyanins as the active ingredients in blueberries.
A small randomized controlled trial suggests that Montmorency tart cherry juice may also benefit the brain. Investigators at the University of Delaware recruited 36 volunteers, 65 to 80 years of age. They had normal cognitive function. For the next 3 months, they consumed either a cup of tart cherry juice in the morning and evening or a cup of cherry-flavored Kool-Aid as a placebo. At the end of the study, those drinking cherry juice scored better on cognitive tests than the group on placebo. The cherry juice drinkers also noticed improvement in everyday memory. Like blueberries, cherries contain anthocyanins as well as polyphenols. These compounds appear to reduce inflammation and lower blood pressure. This clinical study reinforces prior research in animals showing that tart cherry juice may have benefits for human health.
Resveratrol is another compound found in grapes and berries. A new study shows that this compound can help reduce stress. The researchers studied the effects of resveratrol on the stress hormones cortisol and corticosterone in laboratory mice. Increases in these hormones affect the hippocampus in the brain, leading to behavior suggestive of anxiety or depression. Resveratrol inhibits a brain enzyme and protects the hippocampus from stress-related damage.
Proton pump inhibitors, such as esomeprazole or omeprazole, are popular acid-suppressing drugs. Doctors prescribe them for a wide range of intestinal disorders, and people take over-the-counter versions for nearly any kind of digestive complaint. The prevailing view has been that these medicines are quite safe overall, but this view has been tempered by the recognition that their long-term use is linked to a greater risk of bone fractures, kidney problems, and infections. Now, scientists in Austria have found that people taking PPIs are almost twice as likely as other patients to need allergy medicine for hives. They reached this conclusion through analyzing medical records of 8 million adults, covering 39 million person-years of follow-up.
For years, the Food and Drug Administration has maintained that it's unsafe for Americans to import prescription medications from any other countries, including Canada. Such practices are officially illegal, though U.S. citizens have been doing so for years without penalty. Now, in an about-face, the administration is preparing to allow importation of certain prescription drugs from Canada. Alex Azar is head of Health and Human Services. He announced on July 31st that state governments, pharmacies, and drug manufacturers might be allowed to purchase pharmaceuticals from Canada. The Safe Importation Action Plan will likely be selective in that it will allow these intermediaries to buy medicines for cardiovascular problems, arthritis, cancer, and diabetes. It remains to be seen whether individual Americans will be allowed to buy other medicines directly from Canadian pharmacies. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon. I'm a pharmacologist.
And I'm Terry Graydon. I'm a medical anthropologist.
Today we're talking about the health news that matters to you. A recent study published in JAMA Internal Medicine reinforces the connection between anticholinergic drugs and dementia. We'll be discussing the details of this research, and we'll invite you to share your story about drugs like amitriptyline, diphenhydramine, known as Benadryl, and Lomodal, which contains atropine, a little later in the show.
We'll also be talking about some frequently overlooked side effects of cholesterol-lowering drugs, or just getting your cholesterol low. Many people are aware that while statins lower cholesterol, they may also cause muscle pain or weakness. Fewer people know about neuropathy. A study that came out this spring shows a pretty strong link. Have you had any difficulties with nerve pain or numbness while you were taking a statin drug?
But first, let's discuss a common problem almost everyone has experienced: mosquito bites. What do you do about the itch? Give us a call to tell us about your remedy. The number is 888-472-3366. Our lines are open for your calls and your stories. Are you a mosquito magnet? What do you do to prevent mosquitoes from biting in the first place? If you'd like to join the conversation and share your story, the number is 888-472-3366, or you can send us an email, radio@peoplespharmacy.com.
And Joe, there is, of course, a way to keep mosquitoes from biting.
Yes.
You use insect repellent.
Correct. I mean,
That's what it's for.
There's no question that DEET, D-E-E-T, diethyltoluamide, if I'm not mistaken.
Something like that,
and picaridin.
Right?
And what's that,
oil of lemon eucalyptus.
That they're all effective repellents. But, some people say that B vitamins work, and other people say B vitamins are worthless, and the scientific research is actually rather ambivalent.
Yeah, there isn't all that much scientific research on B vitamins, but we do have people who have told us that B vitamins are absolutely great. So Ellie, for example, says, I hate mosquitoes. For the past 25 years, I've been tormented by these evil, blood-sucking stalkers.
Oh, that's a nice turn of phrase. Evil, blood-sucking stalkers. That's what they are.
And she goes on, unfortunately, I am highly allergic to their bite, especially the saliva. My skin swells up to unnatural proportions, and the itching is so intense it's unbearable. And she says, even antihistamines don't help, and neither do any of the remedies. I'd scour the internet daily to try to find anything that might work. Finally, about 3 years ago, I found it. Someone had traveled in Thailand. A pharmacy team in Bangkok prescribed the best preventative remedy, vitamin B1, that's thiamine. 400 milligrams daily. I take 2 250 milligram tablets daily. B vitamins are water soluble, like vitamin C. Your body needs B1. It eliminates the excess in the urine. And she says, this works. The odd bite I did get didn't cause that histamine reaction in my body.
Now, there is a lot of science that says it doesn't work.
There is indeed a lot of science. Well, not very much science, but the science that there is says thiamine,
Worthless.
Ineffective against mosquitoes. Interestingly, Joe, several years ago, probably more than 10, we got a message from a fellow who lived near Charlotte, North Carolina, and he said, for decades, I've been taking thiamine to ward off the mosquitoes because I'm a hunter, and I'm out there in the woods. And he said, for decades it worked. And then the Asian tiger mosquitoes came into the area, and the thiamine is useless against these new types of mosquitoes. And I think they're pretty widespread now.
888-472-3366 if you've got a way to prevent mosquitoes from biting or for dealing with the itch. But Terry, the person who contacted us, she actually sounds like she has Skeeter syndrome.
It does sound that way. Now, tell us, what is Skeeter syndrome, Joe?
We didn't even know such a thing existed.
Well, and then you found this phrase in a medical journal.
Yeah, I think it was American Family Physician. But here's another person who says, I suffer from unusually severe reactions to mosquito bites. Each bite causes a red swollen area the size of a quarter. I've learned to never scratch as the red area will grow to several inches and take weeks to clear up. Last summer, about 20 bites while I was gardening caused an immune system reaction that triggered eczema that lasted for months. After I'd suffered for years, a dermatologist prescribed triamcinolone. It's been life-changing. Just the smallest dab on a mosquito bite makes it disappear within 24 hours. A bite rarely needs a second application. Why isn't this medicine mentioned as a treatment for extreme mosquito bite reactions?
And actually, when you found Skeeter syndrome, that is the sort of thing that they do recommend, a prescription strength corticosteroid topical.
Right. Over-the-counter steroids probably won't cut it.
Are not strong enough. Joe, let's go to the phones. 888-472-3366. We're talking to May in Fayetteville, North Carolina. Welcome to the People's Pharmacy, May.
Hello.
Hi, May.
Hi.
How do you ward off mosquitoes?
With Skin So Soft by Avon.
Yes. You and a lot of other people.
We've heard from Marines for decades that when they're out in the area where mosquitoes are biting, and Fayetteville is certainly an area where a lot of Marines hang out, that Avon Skin So Soft actually does the job. I even think Avon Skin So Soft has now made a mosquito repellent. They put an ingredient right in one of their products. How well does it work for you, May?
It works well because I have 3 boys, and they are very active. They stay outside. I spray that on them. They do not have any trouble at all.
Well, thank you so much.
That is wonderful. Thanks so much.
Sharing. Bye-bye.
And shall we go to Dallas, Texas, and see what Stephanie does?
Yeah, let's hear your solution, Stephanie.
Hello.
Hi,
Hello, Stephanie.
I use Bath and Body Works warm vanilla sugar lotion, and I never have a problem. And I gave the idea to a friend of mine who works on a golf course, and she said it was her saving grace.
Oh, that is cool. So Bath and Body Works. So this is also similar to Skin So Soft. It's like an after bath thing.
Well, it's warm vanilla lotion. It has to be vanilla. It could be. I'm sorry, warm vanilla sugar, but it has to be vanilla.
Okay.
You can use vanilla or like a citrus lotion, and either one repels the mosquitoes. I just prefer vanilla for the scent.
Well, thank you very much for
Stephanie.
sharing. Now,
And Joe, we have a message from Nadine, also in Texas. She says Avon Skin So Soft spray was the only thing that repelled sand fleas in the swampy areas of South Carolina. Spending weeks in swampy environments as an active duty Marine, DEET products coupled with the sun's rays damaged my skin. The Skin So Soft was mild and repelled all kinds of bugs. The troops and I would mix 1 capful of rubbing alcohol in our bath oil spray bottle. The effects only lasted a few hours, but it works. I've tried every kind of bug repellent, but Skin So Soft is the best.
Interesting. If you get bitten by a mosquito.
Yeah, then what do you do about the itch?
So if you have Skeeter syndrome, what you want is a strong corticosteroid. Ask your dermatologist or your doctor. Triamcinolone works. I happen to be super sensitive to chigger bites, and I use clobetasol, probably the most powerful prescription topical corticosteroid there is. If I get it on fast enough, the chigger bite doesn't get out of control. But if you're a normal person, unlike
like me,
like you, what to do for a regular, in quotes, mosquito
itchy
bite?
Mosquito bite, hot water.
Yeah, and we read about this in a dermatology textbook in the 1960s. It has to be hot enough to be uncomfortable, but not so hot that it will burn.
You definitely do not want to burn your skin. Here's one way you can do it, Joe. You've got your cup of coffee in the morning. It's fresh. It's really hot. You stick your spoon in. It's better if you haven't put sugar and cream in your coffee yet.
Right.
And then you take that spoon out and put it right on the mosquito bite.
For a couple seconds.
Yeah,
now,
and it's hot. It stops the itching.
Now, if you're out in the woods and you don't have hot water, there are some devices.
There are indeed. These are battery-powered devices that provide just a little bit of heat, just enough, to that focused area. It's called Thermopic. There's another one called Bite Helber, and these seem to work pretty well to stop that itching for 2 or 3 hours at a time.
Right. So these are battery-powered, heat-em-up kind of things, and you just apply it to your skin for a couple of seconds. Is that right?
That's my understanding. Yes, I've not used one.
And some of our readers say they really work just about as well, if not better, than hot water.
Absolutely.
Well, that's really excellent advice. So, and let's not put down DEET, picaridin, or that lemon eucalyptus.
No. These insect repellents are effective, and if you are in an area where mosquitoes are carrying nasty diseases
like Zika, West Nile, equine encephalitis, dengue, nasty stuff,
chikungunya,
you
definitely want to prevent mosquito bites if at all possible. So you want to use an effective repellent.
We need to take a break, but when we come back, we're going to switch gears.
Are you taking a medicine that could make you confused or forgetful?
A surprising range of common drugs have anticholinergic activity. That can be a problem, particularly as we get older. Do you know whether your medicine has anticholinergic action? Give us a call and share your story. 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. Kaya Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. If you would like to purchase a CD of this show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show, 1174. That number again, 800-732-2334. Visit our website, peoplespharmacy.com. You can also download the free podcast from our website or wherever you get your podcasts.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today on the People's Pharmacy, we're talking about anticholinergic drugs. A recent study in JAMA Internal Medicine has strengthened the link between these medicines and an increased risk of dementia.
Now, Joe, anticholinergic.
That's a mouthful.
It's a pharmacologist's wonderful term. They love it. You're a pharmacologist.
I love it.
You're going to have to explain it because to the rest of us, it sounds like wah, wah, wah.
Okay. Let's start with, and you know, this is kind of interesting. I tried to find out what is the official pronunciation for what I have always called acetylcholine. Well, people pronounce it all kinds of ways. For example, acetylcholine and acetylcholine, but basically for our purposes today, I'm going to call it acetylcholine. It is a neurotransmitter. It is essential for virtually every muscle in your body. If you want to lift a pencil, you have to have acetylcholine working effectively.
Okay.
Too much, too little, you get into all kinds of problems. But acetylcholine is also essential in the brain.
That's what I was wondering because muscles are great, but they don't have much to do with your brain. You got no muscles in your brain.
Well, we think that acetylcholine is very involved in the whole process of dementia, in particular Alzheimer's disease. So the drugs that are available and are not very effective actually help build up acetylcholine levels. So bottom line, acetylcholine, critical. Well, then what's an anticholinergic drug? Well, it's just what it sounds like. It has acetylcholine-like activity. It binds to those receptors.
It blocks this neurotransmitter in some places.
Precisely. And there is now this brand new research, and the title is Anticholinergic Drug Exposure and the Risk of Dementia, a Nested Case Control Study. JAMA Internal Medicine came out end of June. And it reinforces what we have suspected for actually a very long time, that anticholinergic drugs might affect the brain and memory. And, you know, we should have known this because if you go back 100 years ago, German obstetricians were trying to help women going through labor and delivery forget the experience. They came up with something called, and I'm going to mess this pronunciation up so you get to help me here, Dämmerschlaf.
I think that's pretty close.
Close enough, maybe?
Yeah.
It was called twilight sleep in English. And basically, the German researchers said it clouded consciousness with complete forgetfulness. What was it? It was a combination of morphine and scopolamine.
Now, scopolamine, that's a medication that people use a lot for seasickness, right?
Right. Transderm scope. You put a little patch behind your ear. It is a powerful anticholinergic drug, along with another drug called atropine. And atropine is found in a diarrhea medicine called Lomotil. And so there are a lot of drugs that most health professionals are aware of that have anticholinergic activity.
Well, we've got a story here from somebody called C.S. who writes, many years ago, my urologist prescribed Ditropan, and I took the drug for about 4 years. I had an hour's drive to work every day, and I began to realize that many days I could not remember the drive. I'd arrive at work with my mind in a somewhat fuzzy state. I happened to pick up a new prescription for Ditropan at the pharmacy and started reading the side effects of the drug. I saw that my symptoms could be connected to the drug. I stopped taking it immediately and decided to try to control my bladder some other way. My symptoms went away, and I've not had any problems since.
Well, have you ever experienced forgetfulness, brain fog, memory issues that might have been caused by your medicine? Could that medicine have been an anticholinergic drug? How would you know? Give us a call, 888-472-3366. You can email us, radio@peoplespharmacy.com. Again, if you've worried about your medications and whether or not they have anticholinergic activity, or you've had a problem with something like Ditropan, which is known generically, I think, as oxybutynin, but there are a whole bunch. There are dozens, scores, perhaps hundreds of drugs with anticholinergic activity, including diphenhydramine, DPH. That's also known as Benadryl, and it's found in almost all over-the-counter, what I call sleeping pills, PM pain medicines.
PM pain relievers. So Advil PM, Tylenol PM.
Aleve PM. If it's got PM, it's probably got diphenhydramine. That number again, if you'd like to join our conversation, 888-472-3366.
And Joe, the British researchers who were looking at who published this research, they found several different categories of drugs were especially problematic. They had some anti-seizure medicines. They had antipsychotic drugs, like Abilify, for example. They had anti-Parkinson drugs, and they had anticholinergic antidepressants, so similar to amitriptyline and including amitriptyline.
Well, a lot of people are taking amitriptyline now. It's an old antidepressant, but they're taking it for sleep. They're also taking it for nerve pain. So amitriptyline has had something of a resurgence, but even some of the more modern antidepressants like paroxetine, Paxil, may have some anticholinergic activity.
And if you are perchance taking more than one of these medications, that adds to the possibility that they could scramble your brain.
Well, I think that's a really critical point. It's called the anticholinergic burden. So if you're taking just like one drug, maybe you take Aleve PM on left-handed Thursdays, that's probably not going to cause much trouble.
Especially if those left-handed Thursdays don't come along very often.
Exactly. But on the other hand, if you're taking, one of these PM pain medicines every night, and you're taking something for an overactive bladder problem, and you're taking an antidepressant like paroxetine or something like amitriptyline, as you add more and more medications to the list, that anticholinergic burden goes up and up and up, and that's when we get worried. But never stop one of these medicines suddenly. And sometimes if you're, for example, taking a Parkinson's medicine, you may have to continue taking it. Just reduce the other anticholinergic drugs that you may be taking.
Let's talk to Stacy in Durham. Welcome to the People's Pharmacy, Stacy.
Hello.
Hi, Stacy. What's up?
I've been diagnosed recently with fibromyalgia, which happens to essentially be a brain miscommunication as far as pain is concerned. And the typical pain meds that we take, like gabapentin, Lyrica, they're specifically designed to stop brain signals so that the pain is lessened. And recent studies of both of those have come to find that it doesn't just stop or hinder the signals, but it also keeps new signals from forming.
Which is not very helpful when it comes to thinking ability, although it probably is pretty helpful when it comes to blocking that pain.
Yes, but, of course, blocking new brain signals also means that later on, once you lose a connection, you're not going to get it back. There's no chance to get it back. And so
a lot of fibro patients that do have to take these kinds of medications end up with, memory loss, Alzheimer's, dementia, and things of that nature as well.
Yeah, this is a real bind. It's a challenge because people who have fibromyalgia, people who have neuropathic pain, nerve pain, are frequently put on these gabapentinoid-type drugs. But sometimes there is an impact. People complain about memory and brain fog, and it's a trade-off. I mean, the pain can be unbearable.
Yeah, we were just mentioning amitriptyline, for example, and although it's an older medication that was prescribed, before gabapentin and Lyrica were available or approved for fibromyalgia, a lot of people who had fibromyalgia were prescribed amitriptyline for the pain.
Exactly. Stacy, thank you very much for the call. We really appreciate your input.
Thank you so much.
Bye-bye.
Bye.
Okay, shall we go to Lisa in Raleigh, North Carolina? Hi, Lisa. Welcome to the People's Pharmacy. What's on your mind?
Hi, thank you. I wanted to just let you guys know of a recent event. I have an elderly mom, and she had been on bladder medication, and they increased her dose, and she started experiencing extreme forgetfulness to the point where she was hospitalized, and they did all these tests thinking she had had a stroke, perhaps. They did numerous tests on her heart and everything and couldn't come up with anything. And they started reducing her bladder medication, and slowly her memory started coming back. I mean, we were at the point where we thought we had to change her where she lived, and we thought it was more dire, but it turned out to be the bladder medication.
So this was some medicine for overactive bladder. Do you happen to know which drug it was?
No,
Okay.
She told me at one point, but I can't remember exactly which drug it was.
There are several, and most of them are pretty strongly anticholinergic. So these are drugs like tolterodine or...
Well, what's so interesting is that overactive bladder or incontinence, these symptoms are very disturbing to people, understandably.
They're also, unfortunately, pretty common in older people.
And one of the side effects of anticholinergic drugs is to slow down what we call muscular activity. So that's one of the reasons why it's given to people who have digestive tract problems, like Lomotil for diarrhea. But it also has a somewhat similar effect on the bladder.
So when you say slowing down muscular activity, you're talking about those smooth muscles.
Exactly.
That we don't have, yeah.
Bottom line, a lot of the drugs prescribed for overactive bladder can affect mental functioning, memory, just ability to think clearly. So, Lisa, thank you very much for the call. I suspect that there are other people who have gone through a somewhat similar situation.
Right. And, the hospital ended up giving her anti-seizure medication. They didn't even diagnose it correctly.
Oh, my.
And she eventually she realized that she was not having seizures, and she stopped that medication, thankfully. But she's much better. She's 93 and very active, and we're very grateful it turned out the way it did.
Oh, absolutely.
Thank you so much for the call. 888-472-3366 is the phone number if you'd like to join the conversation. Have you had to take an anticholinergic drug? How would you even know? Where would you look?
Well, that is perhaps the question that Linda in Tampa, Florida has. Linda, welcome to the People's Pharmacy. What is your question?
Good morning. I'm so excited that you all have brought this up. My husband and I are sitting here having our morning cup of coffee and wondering, after listening, because we've been taking Benadryl almost nightly. We find that it helps us cut the edge and fall asleep quickly. A half a Benadryl sometimes, just enough. But my husband is also on blood pressure medications, and we're wondering if this has anything to do with, Diltiazem, and losartan. He's on those two blood pressure medications.
Okay.
And then he'll take maybe a Benadryl in the evening. But he's having a great deal of problem with memory these days.
Well, we would suggest the first thing to do is to cut out the Benadryl.
Right, because, yes, diphenhydramine is highly sedating, which is why people
use it as a sleeping pill.
Indeed. Now, when a lot of folks take Benadryl during the day for their allergies, they go, oh, man, I feel like I'm underwater. I just want to lie down on the couch and go to sleep. So, yeah, it has been replaced by what we call second and third generation antihistamines that are less sedating. But I think people have been taking way too much diphenhydramine. I mean, literally, there are millions of people taking this drug every day thinking it is over the counter and it's completely benign, and yet it has profound anticholinergic action. Now, as far as the blood pressure pills are concerned, I don't think either diltiazem or losartan have anticholinergic activity.
We've not heard that they do, so I wouldn't worry nearly as much about his blood pressure medicine, but definitely find a different way to get to sleep.
Yes, Linda. The sleep experts say that diphenhydramine is not the best sleep aid that you can buy. There are better ways. Okay?
May I ask you one other little thing about it?
Yes, please.
Does it also slow down your heart rate, your blood pressure?
It's a good
diphenhydramine.
question.
Does it slow heart rate?
I don't know, to be honest. I'm not sure that there's a lot of data on the effect of diphenhydramine on heart rate or blood pressure. I'd be surprised if it lowered blood pressure substantially.
We're going to have to look that one up.
But that's on our list of to-dos. Thank you for asking.
Okay, thank you so much.
You're very welcome. Bye-bye. Okay, Terry, let's go to... where's the next place you would like to go?
Looks like Colby, Kansas.
Okay.
John, welcome to the People's Pharmacy.
Hello, John.
Hello. Hi.
What's up?
Well, several things. From the mosquitoes to where you are right now with the discussion of the anticholinergic medicines. My mother, who lived to about 99, she had, we thought, a mini stroke from brain bleeds, which she ended up with a lot of rigidification. Ironically, her personality and humor even increased, and her speech was not affected, though she probably couldn't tell you her name. But she was on the oxybutynin for a long time.
John, we're having a hard time understanding. The line's not good, and we're headed for a break. But oxybutynin, the bladder drug oxybutynin, definitely is anticholinergic. Thanks for your call, John.
Yeah. When we come back after the break, we're going to switch gears again, and we're going to talk about polyneuropathy and cholesterol. Join the conversation, 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon. This People's Pharmacy podcast is brought to you in part by Verizana.com.
Verizana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's PEOPLE, all uppercase. To learn more, go to Verizana.com. That's Verisana.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. If you'd like to purchase a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1174. That number again, 800-732-2334. Or you can place your order online at peoplespharmacy.com. You can also download the free podcast from Apple, Stitcher, or from our web store. We invite you to consider writing a review.
The People's Pharmacy is brought to you in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com. And Terry, we should say that for people who want to know if they're taking an anticholinergic drug,
there is a list on our website. Just type in list of anticholinergic drugs. Let me spell that.
Yes, please.
ANTI, anti, CHOLINERGIC.
And just say, where's a list of anticholinergic drugs? And you will find what we like to believe is one of the most comprehensive lists that's out there on the web. And we rank drugs by how potent they are in terms of their anticholinergic activity.
Turning now to statin drugs, Joe. Statin drugs like simvastatin and atorvastatin and rosuvastatin are exceedingly popular. They're also controversial, even though it doesn't seem like they should be. They have pros and cons that could and should be weighed for each individual patient. But the statin question has become really polarized.
It has. And, statins are just like any other medicines. They have benefits. They have risks. They, do good things. They have consequences. But one of the most interesting, I would say, it's not new, but it's something that hasn't really, I don't believe, reached the level of consciousness for a lot of people, is something called neuropathy. Nerve pain, numbness would be symptoms of neuropathy. And there was a study just recently published in JAMA Network Open. The title, Association of Serum Cholesterol Levels with Peripheral Nerve Damage in Patients with Type 2 Diabetes. These are German researchers, and they had 100 participants, and they did something called magnetic resonance neurography of the right leg. And they were actually looking very carefully to see what was going on in the nerves of people with type 2 diabetes.
So they were doing MRIs of the nerves.
Exactly. And, people with diabetes are kind of like the canaries in the coal mine.
Well, they're prone to neuropathy anyway as a result of the diabetes.
Exactly. And the question is, does lowering cholesterol, especially bad LDL cholesterol, does that reduce the risk of nerve pain and neuropathy, polyneuropathy in the case of people with type 2 diabetes, or does it increase the risk? And there have been studies on either side.
Well, at this point, almost everyone with type 2 diabetes will be recommended to take a statin because, regardless actually of how high their cholesterol might be, because one of the big problems with diabetes is heart disease. That's what kills people. And they're at much higher risk than people who don't have diabetes. And consequently, doctors have guidelines that tell them you should prescribe a statin drug for all of your patients with diabetes, right?
Exactly.
And so the idea that this statin might be making something worse is a little alarming.
Well, what they found was,
Or
it wasn't
alarming.
just statins. Basically, what they're raising a warning about lowering cholesterol and LDL cholesterol too much.
So they were actually looking at what people's cholesterol levels were, regardless of how or why it was so low.
Exactly. And what they found was that low serum cholesterol levels are associated with neuropathic, that's not good, neuropathic symptoms, and impair nerve regeneration after axonal damage in neurons of the central and peripheral nervous system. So we'd like you to join the conversation. Have you ever experienced anything that was diagnosed as peripheral neuropathy or polyneuropathy or nerve damage or numbness associated with either statins or low cholesterol? We'd like to hear from you. The number?
The number is 888-472-3366. And we go to Joni in Branson, Missouri. Joni, welcome to the People's Pharmacy.
Well, thank you, Joe and Terry. As you should know by now, I'm a huge fan and I buy CDs regularly. But I love the program and you guys do such a wonderful job. I am a victim of neuropathy, peripheral neuropathy from Barnes in St. Louis says Cipro and Levaquin, which I did take for pneumonia. Now, I'm almost 80 years old. I work every day, but I have a terrible time with my feet and now going up my legs. And they tried to get me to take gabapentin, but of course I never touched it. So they say now around here, that's the only hope I have. And I am in a terrible shape. I need to know if there's anything I can do. Just went to reflexology for my first time yesterday. She thinks she can help, but I don't know. Supposedly my nerves are dead, but I don't know that for sure.
Yeah, we don't know either, Joni. If the reflexology helps, that would be great. We don't know whether it could or it couldn't. I'm not aware of any research on it. There is one thing that sometimes is helpful for neuropathy, although I don't know if it would help you at all, and that's benfotiamine.
Yeah, the problem that Joni is dealing with is an antibiotic-induced
neuropathy, and it might be irreversible.
So the fluoroquinolones, as you mentioned, the Cipro, the Levaquin, ciprofloxacin, levofloxacin, can damage nerves. That is now pretty well established. The Food and Drug Administration has a warning about peripheral neuropathy associated with those antibiotics. And the question is, once the damage is done, can it be repaired? Tell us a little bit about benfotiamine, Terry, because we've heard about it in relationship to diabetic
neuropathy. And that is where the research on benfotiamine has been conducted. And there is research on benfotiamine showing that it can be useful against diabetic neuropathy.
What is it?
It is a synthetic tweak of vitamin B1 thiamine. I think it was created in Japan like 50 or 60 or 70 years ago. And it turns out that it prevents the damage that advanced glycosylation end products when sugar starts damaging nerves. Benfotiamine can get in there and prevent that damage.
Would you spell benfotiamine, please?
Sure. B as in boy, E-N, T as in Tom, I-A-M-I-N. Benfo. Oh, I left out the fo.
Yes. Let's try that again.
We'll try that again. B-E-N, Ben, fo, F-O, thiamine, T-I, no H, A-M-I-N.
And
E.
Yes, and there are articles about it again on our website. So, Joni, we don't hold out a great deal of promise for benfotiamine in your case because of the nature of the neuropathy, but it might not hurt. There's also something called alpha-lipoic acid that is also often prescribed for diabetic neuropathy, and there's some data about that too.
And in fact, there are studies of the combination of alpha-lipoic acid and benfotiamine. Go ahead and check it out on our website because we will give you information on dosing, which I don't remember well enough to give you off the top of my head.
Exactly. And, reflexology, there may not be much science, but again, I don't suspect that there'll be a lot of danger let us know if it works, okay?
I will. Joe, the only med I take at all is amlodipine. For all my life, I've got autoimmune disease, and I've had low blood pressure. Now, all at once, I have high blood pressure, that I'm old, I guess. So amlodipine is the least of all of them, they say.
Right.
So I take one of those
And
a day.
Joni, I don't think amlodipine is going to cause you any problems as far as the neuropathy is concerned. And it might be the most appropriate drug for your high blood pressure.
Unfortunately, neuropathy is kind of puzzling, and we don't have wonderful ways to reverse it.
Now, Terry, we have an email from Lawrence. He says, I have high cholesterol due to genetics and have been taking statins for decades. About 10 years ago, I began to feel numbness and tingling in my right foot. It didn't go away, and eventually it got worse. 2 doctors said it was idiopathic peripheral neuropathy. And Terry, would you define idiopathic, please?
Idiopathic just means we don't have a clue why you've got this. I mean, it's fancy doctor talk, but it means we have no idea.
Lawrence goes on to say, I went on my own journey, including a visit to Mayo Clinic to find out what was happening to me. At this point, I've ruled out every possible cause except statins. As soon as I read some of the studies linking statins to neuropathy, I was convinced and have stopped taking the drug. After 3 years of no statins, there was no improvement. I believe the damage is done. This has significantly impacted my work performance and quality of life. Now, of course, no one should ever stop taking statins without a very careful discussion with the prescribing physician. And I think a lot of doctors would say, well, in Lawrence's case, the peripheral neuropathy didn't go away after he stopped the statins, so it probably wasn't the statins. And we have no way of proving that one way or the other. But I do think that this German research is something that physicians should take a look at. Again, it was in JAMA Network Open. And I think the date was end of May.
31st, 2019, I believe.
And it's very powerful, I think, information with regard to the effects of cholesterol on nerve function. Because basically what they're saying is that cholesterol is necessary for nerves to regenerate and to repair themselves. And we tend to think of cholesterol as this terrible substance that causes all kinds of grief. And yet the body makes cholesterol for a reason. It's responsible for our hormones. And now, apparently, according to these German researchers, it's also important for nerves.
Nerves do need cholesterol, at least some cholesterol. Joe, we might not be able to answer the next question, but let's go to St. Petersburg, Florida. Mary, welcome to the People's Pharmacy.
Hi, how are you?
Hi, Mary.
Hi. I was calling because I am on a statin because I had open heart surgery. Rosuvastatin statin.
Okay, rosuvastatin. Brand name was Crestor. Uh-huh.
Right, just 5 milligrams a half a day. And to tell you the truth, I kind of take it like every other day. But my cholesterol readings were very good. But in my family, from my grandmother's side, we have essential tremor. And I haven't been officially diagnosed, but I have all the symptoms. My brother had it. My uncle, 2 of my uncles had it. And so I was wondering, how that would impact me taking this statin. I'm concerned because I think some of my lower cholesterol is because I am really cutting out a lot of meat and watching my diet. And so I wonder if I should have a discussion with my doctor about getting off of these statins.
Well,
I do have numbness when I sit sometimes. If all I have to do is sit for a little bit in a chair or something, I can get up and my leg is numb, stuff like that. And my fingers get numb. So
Mary, you definitely need to have a discussion with your doctor. And my guess is that since you've had open heart surgery, your doctor is going to say this is still an essential drug.
Well, Mary, first of all, for our listeners who have no idea what you're talking about when you say essential tremor, can you describe what this is like? Because there is a genetic component, and the fact that it runs in your family is probably the most common reason that you would have it. So please describe it.
I have, my hand will shake sometimes if I'm nervous at all, or in any kind of even minimal tense situation. Sometimes when I go to lift something, my hands will shake. I can feel, I can almost feel like the fluid's coming on. Your muscles feel kind of queasy. Occasionally that will happen. It really doesn't interfere that much, but my grandmother, they at first had diagnosed her with Parkinson's, and she used to have to carry a straw around with her. And my uncle, her son, had brain surgery at Johns Hopkins to put in a little device that would help to calm his hand so he could eat. I'm not that bad. My brother wasn't that bad. But like when you go to put your teeth together, they'll chatter, little things like that. And my chin will have a little tremor. It's not really interfering with things now, but I'm concerned about, the situation.
Well, I think you've described it really quite elegantly. And, for a lot of people, it really does interfere with the quality of their life. As far as statins are concerned and as far as cholesterol, I have never heard of a connection between statins and essential tremor or low cholesterol and essential tremor. I don't think we understand completely what causes it. There are some treatments like the one you described for your brother.
And we did mention a little while ago that statins have benefits as well as risks. And for someone who has heart disease, someone who's had open heart surgery, the statin benefits almost certainly outweigh the risks.
Absolutely. I would have a conversation with your neurologist, Mary, but I don't.
And your cardiologist as well. You need to talk with both of them, see if you can get everybody on the same page. And good luck to you, Mary.
Thank you very much for the call. Terry, we're almost out of time, but before we sign off today, I'd like to say something about the Safe Importation Action Plan.
Oh, yes. Well, so far it's a plan. It hasn't gotten any further than that. They're talking about it.
Well,
what's going to happen?
This Wednesday, I would call it a giant U-turn when the administration said it's going to allow importation of drugs from Canada. And everybody went, yay, hooray, we're going to save lots of money. But they're not talking about individuals. They're talking about pharmacies. They're talking about states. They're talking about wholesalers. So it remains to be seen if this is even going to be implemented. Now, people have been importing drugs from Canada for decades.
Right. I mean, technically it is illegal. So
yeah, but they're not arresting grandmas
who are bringing in their blood pressure medicine or what have you.
So
right?
We'll keep you informed about the Safe Importation Action Plan as it develops. Well, thank you so much for listening. That's all the time we have.
That is. Lynn Siegel produced today's show. Al Wadarski engineered. And Dave Graydon edits our interviews, but we didn't have any today.
No, and when you visit our redesigned website, you can share your thoughts about today's show and tell us your story about statins, anticholinergic drugs, or Skeeter syndrome.
And when you go to peoplespharmacy.com, you can sign up for our free online newsletter or subscribe to the free podcast of the show. Don't miss another episode. You could share it with a friend.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.